Joining us now is Dr. F. Perry Wilson, Associate Professor of Public Health at Yale University. And I know hearing news like that is just, it's so tragic, I think, because of how vaccinations could have prevented this. But I wonder what you think about this new updated vaccination recommendation coming from Texas health officials in these affected counties, where they're saying that infants should get an early dose of the vaccine and adults without immunity should get a vaccine. Are those effective?
Yeah, they are. The MMR vaccine is one of the most effective vaccines we have against viral illness, about 97% effective. There is, a routine vaccine schedule that most of us have received and much of the country has received. These additional doses or early doses are necessary in the face of trying to control an outbreak. Those are just the decisions that need to be made to sort of create a fire line around a growing outbreak.
Yeah, the vaccination, no doubt, incredibly effective. The recommendations, do you think people will follow them? Because if people are hesitant to vaccinate their children, even if, as we know, science has proven some of their hesitation is not based in science, do you worry that they'll be hesitant to vaccinate their kids even earlier, which is this guidance?
I see what you're asking. Yeah, of course, there will be ongoing hesitancy. People are anxious about vaccines and becoming more so. That said, there is good scientific evidence that vaccine recommendations that come from trusted individuals, including your own personal physicians, have an outsized effect on the decision whether or not to vaccinate. So I would urge all my colleagues in Texas, the physicians in Texas, to reach out to their patients because those messages coming from them to someone you have an established relationship with, people are much more likely to listen to than frankly listening to people like me.
And do you think they're more likely to listen when they see someone in their community dying from measles?
100%. There are multiple surveys that show that as the perceived severity of an illness increases and the perceived proximity of an illness increases, the willingness to vaccinate increases. I think that's just human psychology. In fact, I think one of the reasons vaccination rates against measles has gone down over time, in addition to a lot of misinformation out there, is simply because it was so effective. We eliminated measles in the United States. It just wasn't top of mind. It wasn't something that people even thought about. And so it made it easier to say, oh, well, why should I even bother?
Yeah, and as we're looking, maybe you can speak a little bit more of that, because we are focused on these two states, right, Texas and New Mexico, but bigger picture in the U.S., what has been that trend of vaccination backslide across the U.S.? Because for some people, it may be, why even bother? But that's certainly not the only reason.
No, I think we can't. The elephant in the room here is really the COVID pandemic, and the amount of misinformation about COVID vaccines colored the experience for a lot of vaccines. We saw, a very dramatic decline in COVID vaccine uptake after the initial round of vaccines came out. And this strange off-target effect was that simultaneously with people not getting COVID boosters and things, we also saw a decline in other more routine childhood vaccinations and flu vaccinations. So it had this add-on effect as mistrust of sort of relatively standard and well-established public health measures sort of eroded in the face of this new and scary pandemic. We've backslid quite a bit. And for measles, this is particularly troublesome. It is the most infectious human virus, more infectious than COVID, more infectious than HIV. The only way to stop an outbreak of measles is to prevent infections. And as I said, the vaccine is 97% effective at preventing infections, but you need to vaccinate a lot of people because it'll find those people who are not vaccinated and take hold very readily. It's highly infectious.
Yeah, we're seeing that play out, unfortunately. Dr. Wilson, thank you so much for being with us.